You ever walk into a hospital and just immediately feel your stress levels go up? Yeah. Well, what if that building could do the exact opposite? Today, we're going to dig into this really powerful idea that's changing how our hospitals are built, turning them from these kind of stressful places into actual healing environments. Okay, so let's jump right in. And I want to start with a feeling that I think we've all had, right? That almost universal experience you get when you step into a healthcare facility, whether it's for you or for someone you love. I mean, why is it that the one place that's supposed to be all about healing so often feels confusing, loud, and just completely overwhelming? It's really not just in your head. For a long, long time, the design of these places, well, it wasn't really focused on the psychological and emotional health of the people inside them. And look, this creates some very real problems. We're talking about a higher risk of infections, layouts that are so confusing they just add to a patient's anxiety, constant noise that makes it impossible to rest, and of course, a serious lack of privacy. And this isn't just about the patients. For the staff, clunky, inefficient workflows can lead to exhaustion, mistakes, and major burnout. But what if we could actually design those problems away? What if the building itself could be part of the solution and actively help people get better? This is where this whole big idea comes into play: designing for health. The concept is called evidence-based design, or you'll hear it called EBD. And the definition really says it all. It's about using credible scientific research to make decisions about how we build our hospitals. The whole goal is to get the best possible outcomes for everyone. It's basically about taking the guesswork out of architecture and replacing it with science. And you can really see the difference right here. The old way of designing was often just based on tradition. This is how we've always done it. Or maybe aesthetics, or the opinions of a few powerful people. The EBD way, it's a total game changer. It's built on hard data and research. It focuses on things you can actually measure for patients and staff. And pretty much every decision is backed by solid evidence. So this all sounds pretty great, right? But how does a hospital actually make this happen? It's not as simple as just having good intentions. It takes a really solid plan, a strategic blueprint. It all starts with building a business case that's impossible to ignore. First, you have to really understand what everyone needs, from the patients and their families to the doctors and the administrators. Then, you got to identify how a better design can actually improve care and save money. That's your return on investment. From there, you build your case with all the data to prove it, and finally, you can secure the investment to make it all a reality. And the goal here is so important. You're not just putting up a building. You're creating a tool that measurably improves how patients feel, makes the entire hospital run smoother, and helps to attract and, maybe more importantly, keep the very best medical staff. Okay, so we've got the strategy. Now let's get to the good stuff and see how this blueprint actually translates into the physical design of a hospital. What does building with evidence actually look like? Well, the first thing to know is that this is a total team sport. A successful EBD project needs everyone at the table. You need the hospital leadership, you need the clinicians who are on the front lines every day, you need the designers and architects, the researchers with the data, and this is so crucial, you need the patients and their families who actually live the experience. And this quote from the source material really just nails it. It's all about bringing every single perspective together. When you include everyone who has a piece of the puzzle, you create this incredible synergy that leads to way better, more thoughtful solutions. So let's look at a really clear example of this. A super powerful evidence-based design choice is the move to 100% single patient rooms. Getting rid of those old shared wards completely. And the result of that one simple design choice? Well, the evidence is just overwhelming. Studies show it can dramatically slash the spread of certain hospital-acquired infections, sometimes by more than 50%. That not only keeps patients safer, but it also leads to huge cost savings for the hospital. I mean, that's EBD in a nutshell. A clear design choice that leads to a clear, measurable, positive outcome. And it definitely doesn't stop there. Other proven EBD solutions include things like maximizing a patient's connection to nature, with big windows and gardens, or giving them more control over their own room's lighting and temperature, creating comfortable spaces for families to gather, and just strategically getting rid of all those sources of noise and stress. A huge piece of this puzzle is also designing for the future. I mean, healthcare changes so incredibly fast. So EBD is all about thinking ahead, designing for flexibility with things like modular layouts and spaces that can serve multiple functions, so the building can easily adapt as new tech and new patient needs come along. This all sounds amazing in theory, right? But it does beg the biggest question of all. Does it actually work? How do we know for sure that these design changes are making a real, measurable difference? Well, the answer is a process called a post-occupancy evaluation, or POE. And you can basically think of it like a checkup for the building itself. After it's been open and running for a while, a team goes in to systematically check its performance and see if the design is really delivering on what it promised. And this evaluation looks at two different kinds of data to get the full story. You've got the hard numbers, the quantitative stuff like patient fall rates or how much energy the building uses. But then you also need the qualitative, human side of the story. And you get that through things like staff interviews and patient focus groups. You absolutely need both to really understand the building's impact. So where is all this headed? When you take this data-driven approach, you can really start to see what the future of our healing spaces is going to look like. Now, it's not a perfectly smooth road. There are some real challenges. A lot of valuable research still isn't being used. Healthcare systems are just incredibly complex. And sometimes, there's just a cultural resistance to changing the way things have always been done. But the opportunities, they are so much bigger and more exciting. We're getting way better at turning research into real-world practice. Smart building technology is opening up all these incredible new possibilities, and these strategic partnerships between designers and clinicians are driving some amazing innovation. The momentum is definitely building. And this quote really brings it all home. The goal is to seamlessly integrate these principles to create healthcare spaces that are resilient, that are responsive, and above all, that are genuinely healing. So we're left with this one last really powerful thought. We tend to think of medicine as things like pills and procedures, but all this evidence asks us a different question. What if the hospital building itself was one of the most effective treatments we have?